But I think if you look at the broader picture of all of it, the public health decision makers, they made the decision early on that testing was going to be a key to controlling outbreaks and to tracking the disease. And there are no perfect tests. They're not tests at every street corner, although there are now more of them. And there's no perfect vaccine, no way to do all this stuff perfectly. But I think salivary testing can come a long way to help us get there. So it's a step in the right direction. There are researchers all over the world, actually, that just have studied salivary testing for decades. But the Forsyth Institute, who I'm affiliated with the Forsyth Institute, as you said, they're just at the forefront of all the testing, much of the testing that's going on all over the country and in the world. So they work with the NIH, receive grants, and they help understand better how this test might actually fly in the real clinical world. Well, as I started saying, there's no perfect test and there's no perfect world. And certainly we all have hurdles to overcome in our own lives. In the dental environment, I feel the hurdles are much lower than many other locations because we do this type of work every day. So we collect saliva every day for other purposes. It's just an added tool we have in our office. When people come in here for cleaning, for exam, they can easily spit into a test tube if you want to use the non-scientific way of looking at this. And we can get results on a variety of clinical parameters for many diseases. But for the purposes of discussion today, we're talking about COVID. And so we know that there are tests out there that can now be performed under the supervision of a dentist in the dental office. Some are being developed and now even available for at-home use. So we know that dentists can do this. So from my perspective as a practitioner and my staff, all my staff, we could all do that here in the office if allowed to do so. Sure, it will really increase the access to testing if we allow dental offices to do that. You had asked about the hurdles. The one hurdle that seems always to pop up in many states is that the government or regulators don't allow dentists to do the tests. So we fight an uphill battle many times as dentists, as dental professionals, to be seen as essential or an essential part of the healthcare system. And I can't advocate highly enough for the fact that dentists are an essential part of the healthcare system, and our patients need to get their dental care. It's essential they do so. And help relieve the strain by offering these tests if we're allowed to do so, and I'm confident that we can help.